See, Dr. Buttu, thank you very much for inviting me, and Dr. Teja, thank you very much for that wonderful presentation. I don't deserve that. And I'm not an international speaker. Although I live in London now, but I'm very much Indian, so not an international speaker. But it's been great to hear some of the previous presentations, and I would like to deviate a little bit from what has been discussed so far. I am a dentist by training, but I'm more of a public health professional, and my work has actually centered around how to convert the right kind of scientific evidence into sustainable policies. And that is where I work. And what I've realized of late is that we produce excellent research, we are doing excellent work, but is it really turning into something tangible, especially in the field of oral health? This is something which we have to keep in mind. And like a very ardent student, I was listening to some of the presentations, and thank you very much for enlightening me on the recent developments which are happening. What I'm going to talk about is the transdisciplinary research approach for addressing early childhood caries. Now, I don't understand early childhood caries as well as you all do, but I see early childhood caries from a public health point of view. And so, what I would be presenting you is my opinion or my viewpoint on early childhood caries from a public health point of view. So, consider me as an external person observing the great work which you are all doing. Uh, why this presentation is important, and I would like to give you a context of this. Before giving this context, we have to understand, why do societies invest in health? Why are we talking about health? We are all dentists, dental professionals, but have we ever realized that what are the reasons why societies invest in health? Well, there are various views to it. The first and foremost view is the utilitarian view, which says that if you invest in health, it leads to increase in productivity, and that's the view which is more prevalent these days. Then there is this well-being view, which is again getting prominence, that if you invest in health, it will bring personal and family happiness. There is this whole security view, which is coming up because of the recent pandemic, which locked us down for almost 2 years, that we all share vulnerabilities. We all can be affected by each other, and that is the reason why we should invest in health. And then above all of these is the human rights view, that we all have this as a shared value, that health is a basic human right. So, for us as a health professional, it is very important to realize as to what our clientele or how are our societies which we are serving is investing in health. Now, what has happened in the past 10 to 12 years? I say this as a 21st century discourse, but this is a development which has happened predominantly after 2015. Now, what has happened is that health and development are considered to be interrelated now. You cannot have good health if you are lagging behind in development, and you can't have sustainable development if you don't have good health. So there is a critical importance which has been started given to health, and there is an increasing articulation of health as a human right. And if you look at papers, you will understand and you will realize that decline in many of the disease conditions, be it coronary heart disease, cancers, respiratory diseases, and other infectious diseases, is not due to biomedical interventions, but it is due to changes in the socio-economic position of the people and due to public health improvements. So the bottom line is that advances in science and technology can improve health. But in order to bridge this gap, this inequalities between different people, different sections of the society, you require much more than just advances in science and technology. Now, when I got this invitation from Dr. Muthu, I was a bit scared because I was talking to already, all the people who specializes in periodontics and preventive dentistry. Most of you are. And so, I was thinking, what new can I give you? You know everything. But just to give you a taste of what exactly is the burden of early childhood caries, well, this is the burden. Now, this is a map from the Global Burden of Disease study in which I am involved. And this, although there are many critiques of the study, but it gives you a general overview of where each country is standing in comparison to other countries. And look at this. This is the disability adjusted life years, which is the new currency of measuring disease burden. It's no longer incidence and prevalence. People talk about DALIs these days. And look at this. India and China, they eclipse all other countries of the world in terms of number of total dialyses, and India more than China. This is the burden. This is the burden we are talking about. If we take India and China, it eclipses everything. Everything is dark blue, light blue in this graph. If you take India and China, well, the epidemiologist in you would argue that these are whole numbers. Okay, so you can't just say whole numbers because these two are the most populous countries of the world. Let us take a deep dive then. Let us look at some other numbers. Let's look at early childhood caries prevalence in children less than 36 months of age. Well, our prevalence is still very high. It is between 26 to 50%. Let's go a step further. Let's look at 36 to 72 months now. The prevalence actually increases in India. It becomes 50 to 75%. So clearly there is a life course angle. Clearly there is something which is going wrong. And clearly this is not the direction in which we want to move. Let's look at incidence now. We understand incidence and prevalence, and we all know that India is still a lower middle income country. Let us look at this graph. I apologize for these shabby graphs. Global burden of disease study gives these kind of graphs. I can't do anything about it. But let us look at incidence, which is the number of new cases per year. And this is the latest data which you can get. Look at this red line of India, constantly creeping up, and it is higher than many of the upper middle income countries of the world. So clearly there is a developmental dilemma here. Clearly there is something more than technology, something more than science which is happening here. Okay, that despite being a lower middle income country, our prevalence rates or our incidence rates are higher than upper middle income countries of the world. Let's look at different states now. Clearly there are inequalities between the states. Some states have got very high prevalence, some states have got a lower prevalence. So there are inequalities between the states in India. Apologies again for this very bad graph, but this is just to show a point that it is not a uniform problem across the country. And why is it not a uniform problem? Well, one of the reasons is this. Now, this is a graph which does not actually pertains to early childhood caries, but it pertains to oral health. And where are we in terms of our health systems? This is a nationally representative data analysis which we did with some of our colleagues, and this is from the National Sample Survey Organization of India. Have a look at the ratio, the urban-rural divide of the dental practitioners. 97% of our dental workforce work in the urban areas. This is from a nationally representative data set. Our condition is worse than pharmacists. Our condition is worse than lab assistants, physician allopaths, nurses and midwife, Ayush doctors even. So this is the kind of inequalities we are dealing with in this country. And this is the reason why there is a constantly high prevalence which we are observing. Have a look at this. Now, this is a new analysis on which I'm working. Oral diseases are the eighth most expensive condition to be treated, and these are inpatient cases. Let's look at outpatient cases. It is still the eighth most expensive condition to be treated in India. The average amount of money which is spent on oral disease is higher than musculoskeletal disorders, higher than the ophthalmic disorders, cardiovascular disorders, skin disorders. Clearly, we are lagging somewhere. There is a problem somewhere. Now, what has happened? Sorry for this long introduction, but what has happened is that the world is changing now. The world has realized that non-communicable diseases are continuously increasing and they are slowly overtaking the infectious diseases in many parts of the world. So in the year 2000, United Nations started with the Millennium Development Goals. They were changed in 2015 to Sustainable Development Goals. And the focus area shifted from communicable diseases and maternal and child health more towards non-communicable diseases and universal health coverage, which says that every person in a country should have access to uh, appropriate health services, which are easily accessible and are affordable. And what SDG talks about is SDG 3, Sustainable Development Goal 3 is on health. But what SDG talks about is that all these goals are interrelated. And a progress on any single goal cannot be made until and unless the other goals are taken into consideration. So I was listening to a presentation on iron deficiency anemia. Well, clearly that's a goal which will come under gender equality, which will come under reduced inequalities. But clearly it has got connotations on health. It has got connotations on no hunger. So see, everything is interrelated. And this is what Sustainable Development Goals talk about. And this is what is the aspiration of every country in the world, that by 2030, we will have to achieve these sustainable development goals. India is a signatory to it, and India is aggressively moving towards it. Niti Aayog is publishing documents after documents. They're doing everything. So this is a national public health priority right now to achieve these sustainable development goals. Now let us look at this. Is again, I spend a lot of time traveling, and this is my favorite pastime. So when I was looking at early childhood caries, I am not an expert, so I started looking at papers. And this is PubMed results of all the articles which have been published from India from 2018 onwards. So the blue graphs are the published studies, and the gray graphs are all the clinical studies. So we are very good. Our numbers are increasing. Our number of publications are increasing. 2020, 2022 is still not over. So I think this graph will go very high. And listening to Dr. Muthu and Dr. Kritika's presentation, I'm sure it will go high. But look at the gray graphs. We are very good in our clinical studies. So almost 90 to 95% of the studies which we are producing are clinical in nature. Do you think this will help us solve the problem? Well, partly yes, but completely, I have my doubts. So let us talk about the transdisciplinary research concept, or the concept of research, why we do research. And sorry for being very didactic. When we were testing this, I told this to Dr. Kritika that public health people, we like talking. So, you have to cut me. But it's important that I talk about the concept of research. Now, what's the purpose of research? Why do we do research? It's not for publications. It is to provide evidence-based, context-specific, resource-sensitive, culturally compatible, and equity promoting recommendations for policy and practice. It should improve practice, it should influence policy. And that is why it should convert knowledge into action. That is the purpose of research. So what this research do is, research generates knowledge. The knowledge has to be converted into action. The action has to make an impact, and that impact can be biological, social, or economic. Unfortunately, what is happening is we are generating a lot of knowledge. So we are doing good on the first two, the yellow boxes. But how are we converting into action and impact? That is something to be seen. And I'm very happy that we have got a specific center now on early childhood caries research, and some fantastic work has been done under it, based on the presentations which I heard. So you have to move down this flowchart, and you have to make that impact. Again, we are doing very good with our knowledge generation. We describe the problem very well, the dimensions, distribution. We dissect the problem very well, causation, causality, associations. What are the risk factors? We are very good at it. But now I think it's time to move the envelope towards problem solution. Let us start talking about evaluation of interventions, innovations, problem response. How are you responding to this particular problem? And how will you reduce this problem? How will you scale up these small pilot interventions so that they can reduce the problem? And that is the paradigmatic shift which is required in our research fraternity, especially in oral health, that we need to start moving from the knowledge generation paradigm to knowledge translation paradigm. So now the construct of transdisciplinary research, well, human health determinants are not only individual or family based or community based. They extend across the entire spectrum. And we know these individual factors very well. We know about health beliefs, we know about behaviors, we talk a lot about biology, but these are not the only health determinants. If you move midstream, there are these cultural perceptions, there are socioeconomic priorities, and there is this always this question of access and availability, which will come into fore. Now, my PhD was on adolescents and children living in vulnerable populations in slum areas. They had excellent beliefs. Their behaviors were immaculate. They were not. When you're approaching these children, nobody was really nobody was having risk-taking behaviors. But the cultural environment in which they were living was so sugar-centric that it led to a large amount of caries in the adolescent population. So clearly, the determinants moved from beliefs and behaviors to the midstream perceptions and cultural practices. And above all of these things, there are these global and national factors. And normally, what this means is that generally we see a mismatch between science and commerce. The things which we should consume the least are the things which are advertised the most. Why is this so? This is because there is a mismatch between science and commerce. It's the commerce which always takes precedence. So these are the things which are sold, and things which you see are the things which you will consume. So there is this issue between demand, supply, trade. There is this issue on the stage of development of a country, and I can tell you many interesting stories around this. So whenever you are designing a research, always remember that there is a cascade of health determinants, starting from the individual factors, going up to the global level or the national level factors. And every policy which is made in any part of the world requires interdisciplinary or transdisciplinary research. We need scientific credibility. We require the evidence. We require the rationale. And for that, we require biomedical and epidemiological research. We need to understand the financial feasibility of any intervention we propose, whether it is cost effective, whether it is affordable. And for that, we require health economics research. The proposed intervention should be operationally stable. It should be sustainable. It should be scalable. And for that, you require health systems research. And the most important, whether your community is ready and receptive, whether your community will take these interventions or not. And for that, you require social sciences research. And that's the beauty. That is why you need interdisciplinary or transdisciplinary research, whatever term you want to use. So, in short, the multi-sectorality has to convert into multi-sector reality. And for that, you need transdisciplinary research. Various examples are there, and I'm sure there. I have looked at the presentation. Many of you are presenting actually on these things. What is the impact of fiscal interventions on health? What's the impact of fiscal interventions on tobacco, consumption of sugar sweetened beverages? Where are we in terms of implementation research on health systems innovation? Where are the behavior change interventions for health promotions? And what is the impact of whatever materials we are using on environmental health? These are all some examples of transdisciplinary research which you can consider. In a nutshell, the compass of research must extend from molecules to markets, and that should be something which should be kept in mind. But this is very easily said. It is very difficult to do this. And there are various reasons to it. There are various challenges to this. And there are so many challenges. I will not like to go into detail. I can speak for a day on these things. But yes, there is a lack of multidisciplinarity. We don't really work in multidisciplinary teams. We have an inherent inability, and I would not say that this is a technical inability. It's just our nature. It's the way we are taught. It's the way we grow as a clinician, that we cannot design multi-component in interventions. We are so specifically focused on our subject. It's very difficult for us to understand it. It's very rightly so. It's very basic human nature. Our research is not really focused on problem solving. It's not linked to health systems. And this is a very major problem, that we are not able to communicate with clarity with decision makers, with civil society, or with social media, who can actually change that research into actionable policy. So there is limitations to knowledge transfer platforms. It's a one-way street. We just publish and we forget. So it should not be like that. There is also a receptor block. Now, we might produce excellent research, but there is a receptor block on people who consume this research. And there are various reasons to it. There is a lack of awareness or understanding on the issues. There is a mismatch between research results and decision makers' priorities. We take 6-7 years to produce research, and by that time the governments change, the policymakers' priorities changes, and so everything changes. So there is this mismatch. There is different time dimensions, and then our research, it talks mainly about ifs and buts. Giving an example of Dr. Harshini's presentation, we were talking about association. We were not talking about causation. So we were talking about facultative associations, ifs and buts. We don't talk in yes and no, which a policymaker want to hear. And then there is a general disdain for academic research. I will not go in detail on this point. It will sound like a human rights activist otherwise. And of course, there is lack of multi-sectoral coordination. Now, there are various other barriers also, which you have to understand. Researchers have a narrow focus. I talked about this. Again, there are differing idioms which we used, and evidence interpretation. The way we interpret our evidence is not necessarily the way in which people want to hear this evidence. Then there are these restricted grant making pathways. So, you'll have a grant which specifically will focus on dental materials, or you will have a grant opportunity which talks specifically about a particular disease condition. So there are these very restricted grant making pathways which impedes this kind of transdisciplinary research. And then there are these limited academic rewards and recognition for multi-author publication. Everyone knows that the number of people whom you tag along on the paper, the less important it becomes for everyone who is a constituent on that. And then there are transaction costs. It costs time and money to gather transdisciplinary. However, there are so many challenges, but there are opportunities also. The world is changing, as I said, and now there is a greater interest in mixed methods research, big data research, and a lot of focus is now going on the implementation side of things. How are you going to implement these interventions? And that's an opportunity knocking on your doorsteps. Again, as I said, there are various problems. I should not go into this, but yes, these are certain things which I have heard when I started building this multi-sectoral team. When I was working in India, I still work in India and in UK. There are information gaps. Your problem does not concern me. Who are you to tell me where should I invest in my research? And why should I spend my money on your priority? And then the most important question, who's going to be the PI? Who's going to be in charge of the project? And that becomes very important. That there are incentives for multi-sectoral action. As I was mentioning that, you can set up clear regular communication channels. Uh, you can be the co-producers and co-beneficiaries of health. And above all, there is joint accountability and everyone becomes accountable. So just to conclude, even when we are talking about management of early childhood caries or prevention of early childhood caries or whatever we want to call it, I think it is very important for us to understand where are we and where do we wish to be by 2030 when the whole world is going to analyze the progress on sustainable development goals. You know, where do we want to reach by 2030? And that is a national priority also. It's not a global aspiration only. It's the aspiration of India as a country. And can we get there only by focused research on early childhood caries? Or is there a need to integrate with other conditions like NCD prevention and control, non-communicable disease prevention control, health system strengthening, or in the agenda of sustainable development? Should we do both engagement as well as focused research on ECC or by being partially integrated? Well, that's a question which you and I think the Center for Early Childhood Caries can answer this. What's the vision and what's the roadmap to reach 2030? Where do you want to reach by 2030? But above all, I think it is the right time, and with the kind of research acumen which you all have developed, it's the right time that we should start talking beyond the conventional. Let's start talking about integration. Let's start talking about grand convergence. Let's talk more about social determinants. Let's not use socio-economic position only to adjust in logistic regressions. Let's talk about them as a determinant of health. And let's talk more about innovations and infrastructure for prevention. It was so enlightening to hear about the Oxis classification. I've never heard about it, but it's so, it fills you with pride to hear that these are the things which are being done in India. And when I talk about innovations, I talk about frugal innovations, local, homegrown innovations, which are cost effective and which can help in prevention. And that will make a very strong case for transdisciplinary research and multi-sectoral action. So we have seen that the 20th century was a century of shared vulnerability. 21st century is the century of shared values. I think we need to develop these shared values and we can reach universal, as Matthew Torga, one of the authors which I follow, says that universal is local without walls. So how can we augment the capacity of early childhood caries research? Well, our current research mainly focuses on it's not only early childhood caries, every research. It mainly focuses on epidemiology. We are very good with our epidemiological studies, or the frequentist statistics, logistic regressions, chi-squares, and we know our ANOVAs very well. Quantitative methods, pilot studies, So what we are doing is we are answering the question of so what. Okay, we are still answering the question, why is this an important topic to be studied? I think it is time now to move from so what to then what. So the focus should now start shifting from epidemiology towards implementation sciences. We should start talking about more important things like Bayesian probabilities, looking at bootstrapping techniques to advanced statistical techniques, just going up a notch above from our normal regression models. Quantitative methods should now make way for mixed methods. It's very important to understand what your community is percepting about you. If your community is not ready and receptive, any possible intervention, be it the best intervention of the world, will fail. And then we need to convert our pilot studies into scaling up studies. Innovation is always a catalyst in low and middle income countries like India. And as I said, we should aim towards frugal innovation, looking at new products, new methods of delivery, and new methods of evaluation. That is something which will always lead us to the right direction. So this is what I've taken from the WHO implementation manual on ending childhood dental caries. Look at these research priorities which have been outlined by WHO. And this is what I'm talking about when I talk about multidisciplinary or transdisciplinary research. Have a look at the research priorities which they have outlined. Integrate early childhood caries prevention within primary care. Promote, protect, and support exclusive breastfeeding. Align ECC interventions with health promotion initiatives like ending childhood obesity. Increase efforts to ensure access to clean, safe drinking water. And this is not me saying this. This is the World Health Organization. And clearly, each and every one of these research priorities are truly multidisciplinary or transdisciplinary in nature. We have to ensure that oral health is on the agenda of any primary healthcare debates. So, you should be on the table when we are talking about primary healthcare. We should be on the table when we are talking about health workforce planning, and we should be on the table when we are talking about health financing, or we are talking about financial protections. And the universities have a major role to play. And this is what my mentor always used to say, that every individual should be T-shaped. We are I-shaped individuals most of the time, that we have got a domain expertise. We are very, very good in our domain. Nobody can match us. We know in depth everything. But he said that there should be a horizontal line over the eye. We should be like a T-shaped individual. And this is where the role of universities is very important, to develop these kind of domain expertise for sure, but also bringing in transdisciplinary thinking and real world awareness, so that the people know what is happening around them. So they have got a depth of expertise and a breadth of experience with them. Okay. This is where I would like to end, that if we don't create the future, the present extends itself. Let us not be the generation who just extend the present status. Let us be the generation which creates the future. And my congratulations to Dr. Muthu for this fantastic center. Whatever I have heard has been excellent. All my best wishes to you. Thank you, and happy to take any questions.